So I just want to welcome everybody to today's Detroit Water Panel. Thank you to our panelists for attending, and we're just going to get started. But we have a few points of business to address before we get into the panel. So first, we're going to talk about our upcoming events. Then next, we're going to start introducing our panelists. Then we'll go into a moderated question and answer with questions we prepared ahead of time. Then we'll go into an audience question and answer section.
Hello, how's everyone?
So during for the audience question and answer, please type your questions in the chat during the panel, and then we will take those questions and have you ask them during this portion. And then at the end, we will have a take-home activity for you all. And the last meeting of the year will be on December 3rd. We will be hosting Dr. Thomas Nichols. He will be talking about communications, and science communication is something we've been talking a lot about this semester. So you can start registering for this event on our Instagram, in the bio, or on our website. So now we are going to start introducing our panelists, starting with Monica from We the People.
So Monica Lewis-Patrick is the president and CEO of We the People of Detroit. Monica, if you want to kind of expand on your experiences and what you do, that would be awesome.
Yes, thank you so much, Shada, and to the rest of your guests. My name is Monica Lewis-Patrick. I serve as the president and CEO of We the People of Detroit. Our organization is committed to the human right to water. We not only work on water, but then we also have our own community research collective that looks at these issues and other issues of concern. And then there's also We the Youth of Detroit, which is our youth leadership component of our work. And then we're in multiple coalitions and collaborations around not only water, land, and housing, focused primarily on Detroit, but also serving in a regional, state, and national capacity.
Awesome, thank you. And
Thank you.
next, we are going to introduce Mr. Bill Wylie-Kellermann, who is a nonviolent community activist, and he is also with We the People of Detroit here today on our panel. If you want to expand on your experiences as well, that would be fabulous.
Yeah, thank you very much. Greetings to all. I'm a retired United Methodist pastor, most recently from St. Peter's Episcopal Church. Actually, for 5 decades almost, have been involved in movements which engage nonviolent direct action. And most recently, that's been particularly with the Detroit water struggle, and in collaboration with We the People of Detroit, but also the National Poor People's Campaign. I've been on the community research collective of We the People for the last 3 years.
Wow, awesome. Thank you so much for you both being here today. Brianna, if you want to go ahead.
Hello, everybody. Our next panelist is Dr. Shawn McElmurry. He is the Associate Professor of Civil and Environmental Engineering at Wayne State University. And if you wanted to give a little introduction and background.
Sure. Thank you. Delighted to be here amongst the panel. We've got some great speakers, so quite an honor. My background is in environmental engineering, although I am a licensed professional engineer. I consider myself more of a scientist than an engineer, really. And so a lot of my career has been trying to understand how water quality, whether it be surface water quality, or in this case, lately I've been primarily focused on drinking water quality, impacts human health. And so when I came to Wayne State, one of the reasons I was drawn to Wayne State was it's an urban community that has a pretty old water system, and there's a lot of challenges that are faced with that kind of scenario. So I'll be happy to talk about that as we go on.
And last but not least, we have Dr. Peter Hammer from the law school at Wayne State, and he's also the director of the Damon J. Keith Center for Civil Rights at Wayne Law. So, Dr. Hammer, would you like to say more?
We'll just keep it short. I direct the Damon J. Keith Center for Civil Rights, and at the Keith Center, we believe that structural racism is our generation's primary civil rights challenge. And we define structural racism as the interinstitutional dynamics that produce and reproduce racially disparate outcomes over time.
Alrighty, thank you all so much for introducing yourselves. I think we have a great variety of experiences and expertise here. So now we're going to move on to our moderated discussion, where we will be asking our panelists different questions. These questions we'll either ask to the panelists directly, or they'll be open to all panelists to answer. And then while they are doing that, if you guys, the audience members, have any questions that pop up in your minds while the panelists are discussing anything, go ahead and type them in the chat. And then when we move on to your audience Q&A, we will go ahead and choose a few, and you can ask a panelist directly, or leave it open to all panelists as well. So let me stop sharing and we can get started with the discussion. So we're actually going to start with a question that is open to everyone. And the question is, water is a nationwide crisis, and what makes Detroit stand out with this issue in particular?
I'm happy to jump in if to start. What I think makes Detroit is different is the incredible hyper-segregation of the region. The water system is in theory a regional system, but has never functioned as a regional system. And we have this sort of very balkanized political environment, which has an overlay of racial segregation. So when you're talking about water in Detroit, it's not just a fight over water, and water systems can be complicated enough. Is really a fight that's taking place in ground zero in America for spatial structural racism. So if we're not lifting up the racialized dynamics of the water problem, we're missing about 90% of what's important.
Oh, go ahead, Bill. Go ahead.
Yeah, I would say, I mean, I totally agree with what Peter's put forward, but I think one of the unique things about Detroit and Michigan, in fact, is the whole matter of emergency management and the way in which the water crisis in Detroit has been created, not by elected officials, but by imposed emergency managers who have been over every African-American city in the state. At one point, half the African-American population in Michigan was under non-elected governments, and 3/4 of the elected officials had been replaced by emergency managers. And the shutoffs in Detroit and the bankruptcy, all of which were tangled up together, were undertaken by Kevin Orr, the emergency manager over Detroit.
So I'll jump in here, and I was just going to say that I was going to try to provide a national context to this. That the water challenges that people face across the country are very different from region to region. So there's some regions where, water scarcity. There's a lot of concerns with that, with climate change and everything else that's going on. The Great Lakes is very fortunate. We have a huge, wonderful water supply that is really clean to start with. That makes things a little easier. In some areas of the country, though, you know, there are groups that are completely segregated and not allowed access to municipal water systems. And the only reasonable answer to why that is just because of racial conditions between, you know, who has power and who doesn't. So more of the structural racism that I'm sure that Dr. Hammer could talk about. But in Detroit itself, one of the things I want to bring up is that we assume that our water systems are always the same across the whole system, and that's not always true. There is variations in water quality within systems, and there's certainly a variation in affordability, a certain variation in who controls systems, and so those are the major problems that I see in as far as Detroit's water system.
And probably the only thing that I would add to that is to give folks some more national context for where we are, is that up until 1977, the federal government contributed about 67 to 69% of the dollars that were invested into water infrastructure. Now they only contribute between 7 and 9%. So that gaping hole in terms of the financial burden and where it's resting is now on the ratepayers. So when you have a system like Detroit system that provides water to about 126 municipalities and townships, almost 40% of the state of Michigan gets its water from a well that was invested in and was legislated to extend to the rest of the region. But then the very residents within that same municipality don't have access to that same source. Then as Shawn mentioned, the institutional racism has to be lifted, but we always have to give people the historical context to what has happened nationally and then how that connects to us locally. So up until the late 1990s, Detroit had an a globally award-winning water department. But also if we leave out the fact that we also, as Pastor Bill talked about, if we don't factor in the institutional and spatial racism and how it has played into dividing this state against its own best interests, because Michigan really should be leading on all things water as the Great Lakes state. And we find ourselves being the poster child for what's going wrong with water.
Yeah, thank you. All great points from all of our panelists. And I think it's so important to establish the root causes and the upstream and downstream factors that contribute to this entire problem within our cities. So thank you for establishing that for our audience members. And now we're going to move on to the issue of water shutoffs. Brianna, if you want to take that away.
Yeah, so the next couple of questions are aimed at, like Shreya said, water shutoffs. And the first question is directed at Dr. McElmurry. And the question is, what is the scope of this problem and what are some of the negative health consequences associated with water shutoffs?
So I think that certainly Monica could probably even be better to talk about some of the consequences of this, but I'll point out that, you know, centralized municipal water systems are credited with reducing about half the total mortality and about 3/4 of our infant mortality when they were created in the first half of the 20th century. So these types of water systems are a huge public health service. And so it doesn't take you know, a lot of effort to understand that when you take away this service, you're going to have worse health outcomes. Now, the truth of the matter is that these health outcomes, we still don't have a good handle on. And part of the reason for that is because it's contentious. It hasn't been studied in a way that's allowed us to get firm answers on that. But we don't really need to study it to understand that people not having access to safe, clean drinking water are going to have major health ramifications. And I want to step back a little bit to the last question as well, in that when, you know, Monica brought up a very good point about the shift in funding, the burden, if you will, of maintaining these systems. That's not too far from the challenge of water shutoffs, right? The water utilities would tell you that they're doing that to make sure they get people to pay into the system. But there has been a major shift in who's supporting these systems. And these systems are getting older. And there's a large percentage of our systems that are well beyond their design life. And they require, much more maintenance than they do when they're new. And we've just, as a country, we have not been good about maintaining these types of systems. And this is an American thing as well. So as we get these older systems and we shift the burden onto, smaller communities, of course, when we have communities that do not have the kind of wealth that, might be able to maintain them, it becomes more and more of a problem. So it's really a challenge, and I'm happy to let my other guests speak to the challenges of water shutoffs.
Yeah, actually, our next question is for We the People of Detroit, and it's how have these water shutoffs impacted Detroit residents? If there's like any specific scenarios you could share with us, or stories you have, or anything at all, that would be great.
Well, I definitely want Pastor Bill to share his experience, because he's definitely been leading on some of the direct action work. But for us, probably the most heart-wrenching experience that I've had has been two. One was in 2015, when I got a call from a person by the name of Jean Voorkamp. She ran for mayor in 2013. And Jean lives in one of the most impoverished zip codes in the state of Michigan. And she called me that morning, and anybody that knows Jean is a very, she's a very impassioned person. She's a hard worker, but she's pretty clear-headed. And Jean was crying and uncontrollably, and I couldn't even make out what she was saying. And once I could make out what she was telling me, she was looking at her window and describing the devastation that she was experiencing and having watched a young mother go door to door. And by the time she had gotten to the third house, Jean figured out what was happening. She was just seeking enough water to make her baby a bottle. So she had to go to almost 4 houses before anybody could give her water, because what we figured out in that moment is all of those folks had already been turned off. That to me became something that stuck in my psyche. I just couldn't get it out of my head, because as a mother of 3, I've never had to hunt for water to make a bottle. And then probably the second really earth-shattering moment for us is when an apartment building that had families trapped in it with children and disabled persons, and they were trapped in this building for 2 weeks with no water and sanitation. And there was an amazing young woman by the name of Val Jean. And Val Jean called us saying, what can we do? And there was a call that went out to the activist community, and we all deputized ourselves, as the Honorable Councilwoman Joanne Watson often says. And so at the time, I was unemployed. I had about 3 more unemployment checks. I had a little bit on my SNAP card. And so I took that and bought bananas and apples and oranges and things that people would not have to prepare. Val Jean and the community made a pot of community soup that continued to boil around the clock to feed people. But then there was an amazing group of young men that came. There was a young man by the name of Rome who said, Mama Monica, y'all not gonna be able, because most of us at that time were elderly, middle-aged Black women walking and delivering water. He said, you're not gonna be able to do it much longer, especially going up and down the steps. Let me call some of the bros and get them to come. And these are the young men in the community that many times are thrown away, that people see as disposable. But it was those brothers that showed up and walked those stairs and lifted water for days and days until we could get the attention of local government and media to care enough to respond. So, if you're looking for a story, you also can go to Wayne State. Detroit water shutoff stories are there. There's a whole copulation of, tear jerkers, if that's what will move you and compel you to understand your connectivity to the human right to water. We've all got to recognize it. And in this city of all cities, sitting on the Great Lakes, sitting on international water, the Detroit River, it should not be acceptable that there is any person in the city of Detroit without access to clean, safe, and affordable water. So I'll stop there.
I wanted to bring it over to Dr. Hammer and ask, ask about, are there any current policies to protect Detroit residents from these shutoffs? Because we've seen the impact that they've had. If not, are there any policies that we should be advocating for? And what actions can we as scientists and advocates and community members take to address this problem?
Yeah, I mean, you can think about it on multiple levels. On a grand level, there has been no policy to deal with water shutoffs. Water shutoffs are viewed through an American, very racialized view of blame, that if you can't pay your bills, you're blameworthy. If you're blameworthy, you can be punished, and your punishment is either emergency management for an entire city or water shutoff for individuals. People like Monica and Bill and others have been fighting for years to try to get a policy response, largely through the most logical lens you can think of, which is public health. As early as January of this year, Governor Whitmore refused to declare the water shutoffs in Detroit a public health emergency. And it took a pandemic, right, where everybody's being told they need to wash their hands in a city where hundreds of thousands of households who had their water shut off, they couldn't wash their hands. And ironically, if you want to put it more seriously, it took it becoming a threat that could harm other people besides Detroiters, right? And when it became a threat that could harm people other than Detroiters, the government acted. And then the government declared it to be a public health emergency, and then issued emergency orders that would prohibit further water shutoffs. But that's temporary, right? That's not a solution, and that is coming to an end. And there's fights already in the legislature about what's going to be the fate of that moratorium. And then you can say, well, is there any possible solution, right? And again, you look to Detroiters for solution. About 20 years ago, Detroiters were advocating for a water affordability plan, which is a very simple concept of a sliding income scale that has the dual benefits of actually getting more revenue if you have a water affordability and not less revenue, and you get more equity, right? So the answer, and again, I want to put this in a regional context. The answer is not a water affordability plan for Detroit. The answer is a water affordability plan on a regional footprint that reflects the regional footprint of the entire system, right? So there's some very common sense things that can be done. And it took a COVID pandemic to even take the first baby steps to trying to address this at a policy level.
I would like to ask a follow-up question. Oh.
But can we just build on that very quickly? You not only have the template for water affordability that was authored in the city of Detroit almost 20 years ago, it is the same template that is being utilized right now in Philadelphia. It's the same template that is being looked at and utilized in Baltimore, and it's being considered in Chicago. So what was a grassroots concept that was championed by the late, great Marianne Mahaffey and the Honorable Councilwoman Joanne Watson is still living on. It just has not been, we've not been able to see the full manifestation of it being applied in Detroit and across the state of Michigan. The other thing is I want to call out the bill because you guys need to know. Senate Bill 241 is the bill right now that would garner us at least some level of protection from water shutoffs, because right now you've got about 76,000 Michiganders that do not have this protection and do not have a pathway to get their water restored. And then we want to be very clear on what we're operating under right now in the city of Detroit and the state of Michigan. You're operating under a public health declaration. You're not operating under executive order. And at the state level and at the local level, the mayor of the city of Detroit, in terms of what was authored by the director of the health department, Dr. Fair, they have given you the least amount of protection, because what it says is that you only will have access to relief from water shutoffs as long as there is money for COVID-19 relief. So unless there is a federal infusion of dollars, you still are vulnerable in the city of Detroit. If you're just a student living here, you're still vulnerable to shutoffs, because we know that there is a public health impact to you just living on a block with one person with no water. We know that there are thousands of Detroiters that do not have access to water. So unless you're in downtown and midtown, you're in imminent harm and imminent danger of that impact of not having access to water. So this is not, as Peter said, about Detroit. This is about the state of Michigan, but there needs to be applied pressure across this state around Senate Bill 241 to turn the water on and to turn it on now.
Thank you so much for that, Monica. That was actually going to be the point that I was elaborating on. I just had a question for Dr. Hammer. The last that I checked, this Senate bill was it's like stuck in House. Can you maybe explain what that means a little bit more, and like what we can do as an organization maybe to push that forward or advocate for in some way?
Yeah, and I want to always point to where real expertise in is that we the people. So I mean, Monica's on the phone hourly, keeping track of that. So I'm going to defer to Monica to say what would be most helpful for people to do in this actual minute.
Thank you.
Thank you so much for that, Peter. I'd be more than happy to share with you guys, one, a breakdown of the bill, but then two, a breakdown by district, so you'll know who to target with your phone calls. We primarily need to target Republican areas because those are the folks that right now are being non-responsive. Because what you'll see in this breakdown, you'll also get an idea of how much money they're being indebted to in terms of the inability to afford water per district, and then how many people are struggling in those particular districts, so you can speak specifically to it. But that would be probably the most helpful way right now, is to really light a fire on the phones and the emails of those red districts, to encourage them also to be concerned about their constituents and Michigan by turning the water on and approving this bill. It's our understanding that they're supposed to not go into full session until December the 1st, but lame duck is in process. And all of the fire and momentum that we can garner right now is needed, especially if you have relationships in other parts of Michigan. I think there's a meeting going on right now of the oversight committee. So it'll be interesting what comes out of that.
For sure. Thank you for providing us that info. Sorb, if you want to go ahead and ask the next question.
So I wanted to ask Bill to bring you into this conversation. I wanted to ask you, through your outreach, what have you learned about water costs in the city of Detroit, and how are people affected? So like, what resources are available and how can we help with that?
You're asking about water rates?
Water affordability specifically.
Water affordability, right. Well, Detroit has among the highest water rates really in the country. And water rates can be, because they're, it's not a tax, it's a rate, it can be raised regularly. And ours in Detroit have been, Monica would know the number right off the top of her head, but I have been raised astronomically in effect. And that's what's created the opportunity for the water shutoffs to be imposed on Black and poor neighborhoods in the city of Detroit, where initially it was where people were 2 months or $150 behind in their water bill. And those are actually pretty much the same thing, pretty close to one another. Water bills run like that in the city of Detroit for a household. So people are being, in effect, driven out of neighborhoods that have no future in the city's plan for downsizing, restructuring, and water affordability and the use of shutoffs figures into that restructuring that Peter so often talks about.
Great, thank you so much for that response, Bill. We are going to move on to the next water issue of like the infrastructure problem. And the next question is directed at Dr. McElmurry. And the question is, what does Detroit's current infrastructure look like? And is there any movement towards rebuilding this?
Yeah, so great question. I kind of touched on this a little bit earlier, but maybe I can add a little bit more context. You know, if you ever look up the American Society for Civil Engineers grades for our infrastructure, every year they find a new letter that's between D and F. I mean, it's just, it gets worse and worse every year. And it's something that people will call deferred maintenance. Deferred maintenance is essentially no maintenance. It's maintenance that we know we should be doing on this infrastructure, but we either don't do for one, we don't do it for one reason or another. So the challenge with that is that, we're going to be experiencing more and more failures of our system, more and more leaks of our system, and more challenges. And right now we have about 250,000 water main breaks per year across the country. In Detroit, one of the unique challenges for Detroit, and it's not just Detroit, but it's a lot of older communities that had a big industrial boom at one point, is when we design our water systems, we design them with projections for growth. And so we assume 20, 30 years into the future, we're going to have a growth of whatever percent. So we tend to over-design our systems. And the real problem for us in the city of Detroit is, in addition to just the maintenance and the constant, the aging infrastructure piece, is that in many of our areas, because of, and this is where it gets the regional approach that's been referred to earlier, our population has shifted and it's moved around Southeast Michigan. And so now we have pockets that at one time served a higher density of people and water consumers. And as a result of that, those pipes in the ground are still the same size. And we get pockets of very slow moving water. This is really detrimental to the water quality, and it's a challenge for the utilities to deal with. And so, it just creates another layer of complexity and more need that, of course, always comes down to money. So trying to address these issues is something that's a real challenge for Detroit and a lot of other post-industrial cities that have shrinking populations or economies that have shifted or moved around.
Can I just add to that briefly? The people of Detroit passed a $500 million bond measure, which was to be dedicated to that very infrastructure. And Detroit Water and Sewage was under the same kind of credit cops and swaps, predatory loans from the financial industry that the city of Detroit was. And before the bankruptcy, Detroit Water and Sewage basically used that pot of money to buy its way out of the credit swap. So money that should have gone for infrastructure improvements ended up just being taken by the banks.
And could we have Peter also add right there, because I think that we sort of glossed over a very critical part, is the role that the racialized housing policies played in shifting population, the role that the big three played in terms of shifting their plants to different locations to then shift that population out of the city of Detroit. Because I think that if we don't give that context, it appears as though people just got up one day and decided they'd rather live somewhere else. And they were actually motivated by the racialized policies of housing and also industry moving out to the suburbs that shifted the tax population of the city of Detroit.
Yeah, I can spot briefly. I mean, it's all interrelated. And that's one thing you have to say. If you're going to start dealing with a problem like this, you have to start thinking about this as a complex adaptive system. You've got to start thinking about deep interconnectivity. You've got to think about issues over time. So it's not just sort of a Twitter or a snapshot. So the first thing is we know that water is essential for life, right? Which is why water shutoffs are so damning. But then we know you're not going to get a housing permit or a permit for a new development if you can't provide water. So the provision of water, and it was done through the Detroit Water and Sewer Department, was actually what created the suburbs and what created the wealth in the suburbs, right? So there would be, and this is a little oversimplification, there would be no suburbs if there was no Detroit Water and Sewer Department. But state legislation always required them to charge at cost, right? So by building these suburbs, Detroit didn't make any profits, right? So all this wealth gets created. It then becomes the conduit for white flight, right? So the sort of flowing of white people out of the city is complemented from the water. It's complemented, as Monica is saying, from the transportation policy that created the expressways that destroyed black neighborhoods, that made it easy to get to the suburbs. It's supported by housing policies that subsidized 30-year mortgages and yet didn't provide those same mortgages to black neighborhoods or to black people. So this creation of wealth in the suburb is deeply interconnected to the Detroit Water and Sewer Department. The suburb has always tried to racialize the fight over water, and have always tried to limit the ability of Detroit to even recur its own costs. And to me, it was a real tragedy. So then you have the bankruptcy. So we're building in what Bill's talking about, the emergency manager coming in. At the midst of the bankruptcy, there was a small group of us advocating for what we called the grander bargain. Right? Bankruptcy is all about breaking contracts and renegotiating contracts. So the grander bargain would say, let's break all of those water contracts. Let's renegotiate them in light of the regional needs. And let's use the Detroit water and sewer system as an implicit regional revenue sharing mechanism, where we can start getting not only about the inequalities built into water, but get to the deep inequalities built around housing, right? And education and transportation. And that didn't have a snowball's chance in hell, right? What they did instead was, through the smoke and mirrors of bankruptcy, permit the regionalization of Detroit's greatest asset, right? So now Detroit, which created the suburbs and created the wealth in the suburbs, doesn't even have control over that asset, and that asset is now have control at a regional level, right? So there's sort of injustice upon injustice upon injustice embedded into this, but it's so complicated that the media won't even cover it, right? Because I would argue the media doesn't even understand it, and the people who do understand it are not necessarily those that are recognized as experts in terms of the policy.
I put into the chat an article that will hopefully give some people some connective tissue. It's called the Water Banker Barons. And many of those banks that are listed in that article are the same banks that were protected during the Detroit bankruptcy. So you'll be able to see a correlation between the privatization of water and why certain decisions were made about Detroit's water, because many of those same actors are buying up the water aquifers around the globe.
Thank you, Monica, for putting those resources in the chat. We'll make sure to send these out to everyone in our organization. And also, thank you, Dr. Hammer, for pointing out that the media sometimes doesn't understand these issues, especially when it comes to water in Detroit. And that's one of our goals here, is to kind of improve that communication among people who know the issue, even if they're not like experts. It doesn't matter, they know the issue and they have the information that can be shared to those who fully don't understand the problem and sometimes even act like they do. So thank you so much, that's huge. Saurav, if you want to go ahead and ask the next question.
Yes, so I wanted to bring it over to what's been on our minds all year, COVID. So, so as we know, proper sanitation is necessary to keep this from spreading. And this cannot happen without clean running water. So how has COVID-19 affected communities specifically with water access? And this is open to anybody to answer.
Well, I can only speak from the perspective of We the People of Detroit. We run a water rights hotline where we deliver water, and we distribute on a monthly basis a semi truck of water in Flint and about a semi truck in Detroit monthly. What we have seen from the height of COVID in March, my CFO, Deborah Taylor, who buys water regularly and has a great rapport with our distributors, starting in January, started having difficulties with bulk purchasing of bottled water. We saw as we went from January into February, we sounded the alarm throughout our organization and began to talk to other water activists to ask them if they knew what was happening, because it wasn't because we didn't have money to pay. We could not get anyone to sell us bottled water in any kind of respectable amounts. Going from February into March, after speaking with Bridge Magazine and some other folks, we knew the threat that we were under because we knew that COVID was rapidly ticking up. And we also knew that there were potentially 10,000 families or more in this city. And according to DWSD, there's anywhere from 2 to 3 persons per household. So just that alone was about 30 to 40,000 people that we knew of, based on reports from the water department that they had shut off in 2019, about 23,000 households, and only about 10,000 of those households were able to be restored. So we knew roughly about 10,000 were still off. And this was in January and February. Going into March, we had to deliver approximately, going from 2 semi trucks to 20 semi trucks were unloaded between the middle of March and the 1st of May. And that means hand delivered, hand packed, and unpacked in the middle of a pandemic. And so with COVID, you'll see some of the links I put into the chat is our research that was done through the Community Research Collective, where we have had to, over the last 4.5, 5 years, we've had to sue our government 8 times just for FOIA information in terms of who's being shut off and who's being restored. This is information that the city of Detroit used to mail to your home. So we're finding it just very, very interesting that now information used to give away, we can't sue it and get it. It's just that complicated. The other thing that I think is really noteworthy is the fact that we have seen repeatedly the water department put forward what would seem like a plan to address the water shutoffs, and it really is more of a marketing ploy. It took the water department during a pandemic, after us calling them out on national news and state news, for them to even admit that people in Detroit did not have water. Even after a month and a half, there still were thousands of people without water. Your governor then enacted an executive order, and what the executive order did is it put a $25 deferment plan in place. So nobody's getting free water in Detroit. As a matter of fact, all we got free was the turn on process, but you're still gonna pay for every drop of water that comes into your house. So now you're gonna see poor folks that were already challenged, that now during a pandemic, their water is going to cost them more than many of them have ever even made in a year. So you're gonna see this compiling debt cascading over communities in a way that I think is just gonna be unbearable for the American public to witness. And then what we also had to do is we had to kick and scream, and amazing partners like Alice Jennings and the ACLU, they have been ongoing in litigations against the governor and the mayor to turn the water on. It's striking to me that the very policies we were lifting through public health that they should use to turn the water on is now the very policy that they're using to turn the water on. But what you will see with our data, if you look at the COVID-19 article that was done with Emily Kudel, is that there has not been one neighborhood in the city of Detroit that has not been impacted by water shutoffs and also equally impacted by COVID deaths. There is not one neighborhood that is still not reeling from the economic impact of COVID-19 and health disparities and illnesses and loss of time at work. And so I would just encourage you all to look at that data, digest that research, take the time to find the zip code where you spend the most time and see what the conditions are in that zip code. Because many times if we personalize this work, it'll make us do more than we've ever done before.
Can I add a layer onto that? And those are great points. And the economic impact of COVID is just enormous. I mean, it is. So to have people needing to go out and engage more with others is exactly the opposite of what needs to be happening right now in order to get, water. So I can't get past it, but I just want to offer this additional point. Through research that I'm currently doing, we've been engaging a lot of water utilities. And I know that water utilities are not often viewed very positively, but I will say that this has actually had a major impact on them as well. And the reason why it's particularly concerning to me is that utilities have, people that operate these water systems are kind of aging out. It hasn't the support for the employees has not been there, kept up over time. And so you have these employees that are older individuals with a ton of experience, and they don't have, there's not a lot of fat on the bone in these organizations. And so if that person goes down with COVID, the people that have to step up might not be as prepared as elsewhere. And because COVID is a communicable disease, it is pretty concerning that you could have whole water systems that become infected and become really, it's just scary to me to think how these things could operate. So this is a big challenge. And, I've done work in Flint, and I know their water system there, they don't have a lot of employees, and it's not like they're the only people in the state. There's plenty of other water systems in the state that are really challenged if they were to lose a couple of employees along the way. So just another wrinkle on this, but it's this COVID disaster that we have right now with the lack of good leadership, and there has been some good leadership in our state, thankfully, but particularly at the national level, it's just been abysmal, and it's just sad to me that we are in this state. But I'll stop.
Thank you so much, Doctor. Oh, go ahead, Dr.
One short thing is, back to that notion I talked about structural and spatial racism. The same forces that created wealth in the suburbs have created a racialized poverty in the city. And that means that you don't have quality housing and employment. Those are all related to the social and economic determinants of health. So you're now trying to say, well, why has COVID come back and impacted cities like Detroit or subpopulations like African Americans, other people of color? It's all interrelated again, right? And one of the tools, particularly people in your generation that are inheriting complex problems, have got to create forums like this, but also sort of models that appreciate that deep complexity, that can weave in what Shawn and Monica and I are saying, and saying is all different facets of the same complicated problem.
Yeah, for sure, for sure. Thank you for adding that. We wish we had more time to discuss with you guys. This has been amazing, and you guys are so informative. So thank you so much for the contributions you've made on this panel. And I just want to quickly add before Monica has to leave, but we would love to reach out to all of you guys and ask about additional opportunities that this organization can do in order to kind of make other people aware of this issue. I think one of the biggest things, like I said before, Dr. Hammer, he touched on how some people think they know the issue, but they really don't. So just improving those lines of communication, getting the right info out to the right people, and maybe even discussing a letter that can be written to policymakers in order to encourage them to pay more attention to these issues. So we'll be in touch with all our panelists to gather those resources for our members as well. But right now we just want to quickly ask, I think we had an audience question that Brianna was going to ask. So go ahead, Brianna.
Yeah, so I was going to actually ask Max's question, unless Max, you wanted to hop on and ask it yourself.
Oh, okay. There's no. So, where did I put it? There it is. Oh, so this is just more something I'm more familiar with. But what is your level of concern about the issues associated with Detroit's combined sewer system, and how does that factor into questions about these other issues we've been discussing today?
Are you directing that to someone, Max?
No, just in general, whoever has their own insight on it.
Well, I know for us, the combined sewage overflow issue is an issue, especially in Detroit. It's leading to a lot of flooding, which also for our elderly population and homeowners is causing displacement. And then we're also looking at technology and other innovation to bring to the city, because we believe that we need to decentralize our wastewater system. And we believe as long as Detroiters carry the burden of processing the waste for the majority of southeastern Michigan, that nobody is going to want to take that burden on and then have to dedicate the dollars and the manpower to building that system on an individual basis. So for us, it really, we'd like to see the quirk, which is a concept we've been working with Boston, the Charles River Watershed Association out of Boston, to look at how to bring those technologies here. So I'll put that link in the chat, but I'm sure that Shawn may have more to add.
Yeah, I was just going to acknowledge the challenge there, Max. This is not a easy solution. You know, we have a physical infrastructure that's underground, and to replace all of that in one shot is just, I mean, you couldn't do it, but you know, the amount of money we have invested in that infrastructure is huge. So trying to adapt the system after we've now realized that the solution pollution is not dilution is an enormous challenge, and one which I'm happy that I have a lot of students that are interested in working on. But the impact of those CSOs, in my opinion, are a little bit more indirect than some of the things we've been talking about today. It has a huge ecological impact, which of course we are humans and we live within the same ecosystem that all the other animals do. And so it's just a little bit harder, you know, more indirect, which, you know, human nature, if it's not direct and it's not a threat, immediate threat, we tend to ignore. And that's probably the biggest challenge with that is, but as Monica pointed out, it's not just what overflows that's the problem. There's backups, there's flooding in basements. I mean, there's a health impact from having wastewater in your basement. So there's a lot of, it's really it's a mess. So it's a big challenge.
Thank you so much for that response. I'm just going to go ahead and ask the last audience question that I know we're short on time, but what makes the Flint water crisis different from what's occurring in Detroit? If somebody wanted to give a short and sweet answer to that.
There's no short answer to that. But I would say both cities were under emergency management. Both these crises unfolded under emergency management. So I think there's some interesting root causes that are there. I wrote a lengthy report for the Michigan Civil Rights Department looking at Flint through the same lens of spatial structural racism, but also introducing a notion of strategic racism. The root cause of it lie at the fact that they wanted a new pipeline. Not they, the county and other powerful folks wanted a new pipeline. They rammed that through of the emergency manager at a time when there was no democracy. And they didn't do full cost accounting, which meant that they raised money externally to pay for the pipeline, but not for the water treatment plant. So they had to cannibalize the money that they were spending for clean water to get clean water from Detroit to making haphazard improvements to a water treatment plant that was probably too old to run effectively anyway. And that was the root causes, right? So, I mean, the root cause really is sort of spatial structural racism and the fact that some lives don't matter and that we're not going to invest in them in the same way that we invest in white folks in the suburbs.
Yeah, I agree with everything Dr. Hammer said here. The big, I mean, the big thing that hasn't happened here that happened in Flint was we didn't have a rush to change a water supply without doing the proper steps to do so, regardless of, you know, the intent, which I think was, it was ill intent. But the other thing that I will say is that when I get asked what was the number one problem with Flint, I can't help but think it's just gerrymandering and the disconnect from people's ability to determine their own, you know, governance. It was just a recipe for disaster, and we still have that in our state. You know, not getting worse. It's a mess. So that needs to, and that's the structural racism. So.
I think the important point as well that Peter mentioned in terms of both cities being under emergency management, this was really coordinated by the governor. Not only did the emergency manager in Flint commit to the Karagandhi system and made it impossible for the city to back out of it subsequently, but cutting off from Detroit supplying water put a huge hole in the Detroit water and sewage budget, which was part of its vulnerability to regionalization in the bankruptcy. So this is just, I think we just have to see this as not two emergency managers operating separately, but a coordinated effort, and let's say from Governor Snyder, who has yet to be prosecuted.
Awesome. Thank you so much for your input and expertise. That was quite wonderful. We're just going to quickly segue into our last notes in order for our members to get going. Did I share this right screen? Let me see here. Okay, here we go. So we just want to thank all of our panelists for joining us today. We could have not had this happen without them, obviously, and their wisdom, their expertise, and their call for action. We really appreciate everything you've done for us, and we would love it if we could keep in contact with you guys and continue the discussion after this meeting. So thank you guys so much. And just a little note for our members, we are planning to have a take-home activity for you guys in the near future. Like we said, we'd like to collaborate on a letter with the panelists here to send out to local or state representatives. And we're also collaborating with a local organization called Replenish Detroit. They do a lot of community work involving water, so we were planning to write a blog post with them, and if any of you are interested in collaborating on that blog post with us, please, please, please email us. We would love to have you. That goes for our members and panelists. And then Saurav, if you want to talk about this.
All right. So I just wanted to let everybody know that the sign up is available on the website and on our Instagram for the Tom Nichols event. He is going to be talking about science communication, which is something that we did. We were talking about all of this semester, and as we can see with this issue with the water, communication is key between policymakers and the community, and as long as we have communication, we can help, as we like to say, bridge the gap and fix all these issues. So be sure to sign up for that. It's on December 3rd, again at 1 to 2. So here are the links to the website and to our Instagram is at SciPolDetroit. And email us if you have any other questions.
Thank you so much to our panelists again. I hope everyone has a wonderful afternoon. Enjoy this weather while it lasts. Have a good one, everyone.
Thank you.
Thank you.
Bye.
Bye.
you.